Thank you for watching the video. Even if you can live long when your brain ages, you may not be able to eat what you love. You may lose the ability to travel, experience daily depression, or even forget important people in your life. Even as a doctor who actually sees patients, there are many people who have worked hard all their life, saved money, and then developed dementia at such a timing that they can't enjoy the life they had imagined in their old age. We live in an era where it is said that life is 100 years. But in reality, even if you live to be 100, most people need someone's care in the last decade of their life. On the other hand, there are many patients who are still powerful even in their 80s using smartphones and even traveling abroad. When you reach your 80s, the aging of all organs, including the brain, begins. On the other hand, there are many people who are still cheerful and healthy even in their 80s. What exactly is the difference? This time, from the perspective of a doctor who is actually treating elderly people in their 70s and 80s, I will introduce the characteristics of people whose brains do not age even after they reach their 80s and who are always cheerful. That's what we're going to talk about today. First, I will introduce the latest findings about brain aging. Then in the second part, I will introduce the 5 characteristics of people whose brains do not age. And in the third part, I will talk about the initial symptoms of people who are one step away from dementia, which is something to be careful about. I will explain it in a way that is easy to understand. I will also cover ways to reduce brain aging risk, including diet and drinks. So please watch the full video. On YouTube Medical University, we are broadcasting fun medical information that can be useful from tomorrow from the perspective of active doctors. We would be happy if you could register the channel so that you do not miss the latest videos. That's all for now. Let's talk about brain aging. What does it mean when the brain ages? The representative example is cognitive disease. It's a problem for everyone. How many people over the age of 80 are said to develop cognitive disease? In fact, it is said that 1 in 5 people do, and what's more, it is said that 1 in 2 people develop cognitive disease when they reach their 90s. Understanding the causes of cognitive disease, the most common cognitive condition. It is understood that a disease called Alzheimer's, which is the most common, accumulates a waste product called amyloid plaques in the brain. But what's surprising is that this waste product also accumulates in people without Alzheimer's as they age. The hypothesis that can be considered from here is as follows. The aging of the brain may be a gradual accumulation of waste products that progresses even before dementia sets in. In fact, when examining the brains of deceased elderly individuals, data shows that this amyloid plaque, a type of protein, accumulates in the brains of many elderly people, regardless of whether they have dementia or not. What differences exist between those who accumulate this waste and those who do not? And what kind of lifestyle can reduce the risk and keep the brain from aging even into the 80s are things to consider. In the second part, I will introduce 5 points based on the latest data related to the risk of dementia, eating habits, and sleep habits. Especially the last point is something unexpected that hasn't been mentioned much in other videos, so please look forward to it. But before that, let's review the first part. Dementia is a representative of brain aging. In this era, 1 in 5 people in their 80s and 1 in 2 people in their 90s develop dementia. Even among the elderly without Alzheimer's disease, many have this waste product amyloid accumulated in their brains. As this waste accumulates, the brain ages and eventually develops dementia. I introduced such a thing. Then in the second part, I will introduce the characteristics of people whose brains do not age while sharing my own experiences. On the internet and television, various studies are conducted, and if there seems to be even a slight effect on dementia, it is exaggerated and advertised as significantly reducing the risk of dementia. There are not a few things that are emphasized because they want to sell their own products. Such things may not exist. With that said, first of all, although it is said to be effective for dementia, in reality, the effect is not confirmed much. While introducing such things, I will introduce the characteristics of people whose brains do not age in the second half of the second part. First of all, the following are things that are advertised as improving dementia, but are lacking in effect. These include vitamins, beta-carotene, and beta-carotene. Some are said to be good for the brain, like docosahexaenoic acid and icosapentaenoic acid. There is no solid data that these substances improve dementia. Just because there is no data doesn't necessarily mean it's wrong. There may be people who have actually tried it and felt the effects, but I think there are individual differences, and it's not necessarily something you have to drink. So, if you're concerned, you should discuss with your primary care doctor whether to drink it or not. I think it's okay to decide if you want to, and it says dementia drugs at the very bottom. For those who thought dementia drugs were ineffective, actually, the dementia drugs currently on sale in Japan have been proven to have some effect. However, the effect obtained with the drug is only data that slightly improve the score of the dementia test. Even if the family is actually dealing with it, it is said that there is no improvement to the extent that you can tell that cognitive function has improved all at once. Rather, after starting dementia medication, appetite has dropped and nausea has started. There are more people who are troubled by such side effects. I have actually prescribed dementia medication, but if it doesn't work, side effects may be present, consider discontinuing use. Please remember that it's just that level of medication. Now, let's move on to what everyone has been waiting for. I will introduce 5 characteristics of people whose brains do not age. These are lifestyle habits that may reduce the risk of cognitive disorders. The first of these 5 characteristics is drinking coffee. It's easy to confuse cognitive disorders with coffee, as it can lower your mood and is said to be related to depression. There is a study that followed 50,000 women for 10 years. Of these 50,000, about 2,700 developed depression. When we look at the dietary content of those who developed depression and those who did not, it's quite something. Compared to those who drink less than 1 cup a week or do not drink coffee at all, those who drink 2 to 3 cups of caffeinated coffee a day have a significantly lower incidence of depression. There is such data, by the way. It was said that there was no difference with things like decaffeinated coffee, caffeinated tea, or the amount of chocolate intake, so it was understood that drinking 2 to 3 cups of caffeinated coffee a day could potentially reduce the incidence of depression. In fact, what is called depression is referred to as a mood disorder in the medical world. If you develop depression, you lose the will to do anything and may not leave your home. Your appetite decreases, your muscle strength decreases, and your body gradually becomes weaker. To prevent brain aging and possibly reduce the incidence of depression, why not consider consuming coffee? The second characteristic of people who do not age their brains is the Mediterranean diet. Have you ever heard of the Mediterranean diet? It is a dietary habit that is often preferred and eaten around the Mediterranean in Europe, simply put. It involves eating plenty of fruits and vegetables, consuming more fish than dairy products or meat, and incorporating foods like olive oil and nuts. It's also famous under the name of the Mediterranean diet. I controlled the oil and ate the Mediterranean diet. We have high-quality trial data from a randomized comparison trial involving the Mediterranean diet, where we divided the team that ate the food. We randomly assigned people from 55 to 80 years old to eat the Mediterranean diet, or a diet low in oil. About 7,000 people participated, but those who ate the Mediterranean diet compared to those who ate less food. It has been proven that their cognitive scores improved. How about that? Just by eating a Mediterranean diet, there is a possibility that cognitive scores can improve. We introduced such data. One point to note is this experiment itself. This test compared the incidence of myocardial or cerebral infarction, allowing later review to some extent. It was only later that we found out that the cognitive scores were better for those who ate the Mediterranean diet. So it's hard to say that it's solid data, but it's a result that holds a lot of promise. And this Mediterranean diet reduced the incidence of myocardial infarction and cerebral infarction. That was the result. Dementia, actually called vascular dementia, can also occur due to arteriosclerosis of the brain vessels. So you see, the Mediterranean diet, which can prevent diseases caused by arteriosclerosis, such as myocardial infarction and cerebral infarction, is worth trying, don't you think? The third characteristic of people whose brains do not age is exercise. Exercise is a must, you know. High blood pressure, cholesterol, and diabetes can progress to arteriosclerosis, ultimately leading to risks of myocardial infarction and cerebral infarction. However, it has been proven that exercise can reduce these risks. Not only that, it may also reduce the risk of dementia. I will introduce such data. In fact, Various observational studies on the risk of dementia and exercise show an inverse relationship, meaning that the more you exercise, the lower your risk of dementia. This has been proven. What does this mean? In certain groups, people who exercise and those who do not are divided, and the incidence of dementia in these people is compared. When this is done, it turns out that those who did not exercise have a higher risk of dementia compared to those who did. However, there are some points to note. This does not mean that the risk of dementia decreases because you exercise, but for example, people who regularly exercise have a higher average education level, and the risk of dementia decreases because they have a higher education level. Or people who exercise may be communicating with various people, and the fact that they are communicating may have reduced the risk of dementia. There may be various influences included, so it is not proven that if you exercise, the risk of dementia will definitely decrease. However, exercise is associated with myocardial infarction and cerebral infarction. The data that exercise reduces the risk of life-threatening diseases is clear, so exercise can reduce various risks and possibly even the risk of dementia. So try doing it even once a week, or try changing the elevator you always use to stairs, or improving your lifestyle habits. A little bit might increase the possibility of keeping your brain from aging and living energetically. Please consider it. The fourth characteristic of people whose brains do not age is that they have relationships with people. This is also based on my experience in outpatient care, but people who are still lively even after their 80s, who volunteer, travel with their families, and live a lively life, tend to have relationships with various people. Doctor, I have a neighborhood association this day, so I can't come to the outpatient clinic. Can I postpone it for a week? There are also people who are so busy coming to the outpatient clinic. In fact, it is known that not having a connection and being socially isolated carries a risk equivalent to smoking about 15 cigarettes. Isn't it surprising that being alone carries a risk similar to tobacco? There is also the possibility that it may increase other diseases, cognitive diseases, and even mortality. There is such data. I introduced exercise as the third point, but there is an experiment that compares which is better for the health of the body, doing this exercise or having a connection with people. There are people who go to exercise circles but actually do not exercise, and people who do not go to exercise circles but are working hard to exercise alone. Among these two groups, who will need care in the future and whose life will not be established without borrowing someone's hand? Which group do you think had fewer people who ended up like this? The answer is surprisingly, the first group are people who go to the exercise circle but actually do not exercise and are just chatting with those around them. You would think that those who exercise alone would be more physically fit and less likely to need care. But in fact, those who go to the exercise circle and do not exercise but enjoy the connection with others were less likely to need care. Surprising, isn't it? The connection with people is often harder to see than the connection with physical health, but when shown with data, there is a difference like this. Now for the last one. The fifth characteristic of people whose brains do not age is this. They are people who know that they have a treatable cognitive disorder. I've been forgetting things a lot lately. I don't want to be found out by the people around me because I might have dementia, so I've decided to stop interacting with people little by little. As I start to forget things, I become more and more reluctant to go out, my physical activity decreases and my social interactions decrease, which increases my risk of dementia. However, there are various causes of dementia, and among them, there are treatable dementias. Here is a list of treatable dementias. When we hear the word dementia, we tend to think of Alzheimer's disease, but there are various causes. Pseudodementia is a condition where you lose the will to do anything due to the diseases I mentioned earlier, and you lose the ability to think, which can be mistaken for dementia. The second is drug-induced. For example, some cold medicines can cause drowsiness. In addition to that, some sleep medications can increase the risk of dementia, and in fact, they can lower the level of consciousness and be mistaken for dementia. The thyroid, located in our throat, produces hormones that control metabolism. If the function of this thyroid gland decreases, you may lose the will to do anything. Your metabolism may slow down, and you may even become unable to move, leading to the onset of cognitive disorders. Such things can happen. Other causes include vitamin deficiencies, sexually transmitted diseases like syphilis, and even subarachnoid hemorrhage, a type of brain hemorrhage, can cause symptoms of cognitive disorders. These can lead to the onset of cognitive cognitive disorders. It's not that once you have dementia, it's incurable. Rather than leaving it as it is, there are also cognitive disorders that can be cured. If you know this, go to the hospital, get examined, and start appropriate treatment to get back to your normal self. I have experienced many such people. A man in his 70s came to the outpatient clinic in a state of constant fatigue, with no appetite and steadily losing weight, dressed as if he was about to go to bed. However, after diagnosing him with hypothyroidism and starting treatment, he was completely transformed a few months later, dressed sharply and with a bright expression when he came to the outpatient clinic. It was very impressive. Please don't forget that there are cognitive disorders that can be cured. In the third part, I will introduce 6 symptoms that people with such symptoms may be one step ahead of cognitive disorders or may not be the initial symptoms of cognitive disorders. I often get questions like, I often forget things? Do I have cognitive disorder? But no, this type of forgetfulness is not a cognitive disorder. It's a forgetfulness that anyone can have. This kind of forgetfulness may require a little attention. I will also introduce the difference between normal forgetfulness and forgetfulness due to cognitive disorders. But before that, let's review the second part, the characteristics of people whose brains do not age even in their 80s. The first is to drink 2 to 3 cups of coffee with caffeine a day, which can reduce the risk of depression. I introduced such things. The second point was about the Mediterranean diet, which has been shown to improve scores for cognitive disorders, as well as reduce the risk of myocardial infarction and cerebral infarction. I introduced such data. The third point was about people who exercise, and the correlation that the risk of cognitive disorders is reduced. I introduced that as well. And the fourth point was surprising. Maintaining relationships with people can reduce the risk of cognitive disorders. Being alone poses health risks, smoking 15 cigarettes daily, increasing the likelihood of depression and cognitive disorders. Treatable cognitive disorders require hospitals, proper diagnosis and examination, experiencing forgetfulness. The third element introduced unexpectedly annually. I will introduce 6 early symptoms of cognitive disorders. Cognitive disorders are diseases that progress gradually. If left untreated, it can progress gradually, and by not going out from home, it can decrease. Physical activity and motivation can be lost, and cognitive function can decline rapidly, leading to irreversible events. Such things can happen. In order to prevent this, it is important to catch the early symptoms of cognitive disorders and symptoms one step ahead as early as possible, and take early measures. As I mentioned earlier, the early symptoms of cognitive disorders are not just forgetfulness, but also the ability to perceive space in 3 dimensions may decline, so be aware of that. I would like to talk simply about the screening methods for cognitive disorders. So let's start with the 6 initial symptoms of cognitive disorders. I would like to introduce them. Please listen while taking notes and consider whether these apply to you. The first sign of cognitive disorders is repetition, such as asking the same question multiple times. For instance, forgetting that your live-in daughter has gone to work and calling her repeatedly to ask, "What were you doing today?" To which she replies, "No, Mom, I told you I was at work." It's common to make phone calls many times a day. The second symptom is increased forgetfulness about where things are placed and often searching for them. This occurs because cognitive disorders impair the memory of object locations or new memories, leading to frequent thoughts like, where did I put my wallet? You might often find yourself wondering, where did I put my passbook and such? This happens quite frequently. People with cognitive disorders often feel that they are still fine and don't want to cause trouble for others, so they can't help but lose things. Therefore, they might think, if I put important things here, I won't forget them. They might think, this is important, so I'll keep it somewhere only I know so it won't get taken, and end up hiding it in a special place. Then they can't find it because they've hidden it too well and forgot where they put it. I think I'm fine, but I can't find my wallet. Why don't I have my wallet? I always keep it in the same place. I thought my daughter, who always takes care of me, might have taken it, and I blamed her. I was upset, and I even blamed my daughter. That's about it. This is it. In terms of symptoms of dementia, it's called delusion of theft. You might suspect that the person who is taking care of you, like your daughter or son, might have taken something. Considering dementia symptoms, it's understandable for them to suspect this. When it happens, instead of reacting angrily, try saying, "I've lost something. Where did I put it?" And insist, "I definitely didn't take it. Where did I go?" I also want to search, so let's search together. As much as possible, let's cooperate and go to look for the item. That's the kind of attitude we should have towards each other. It's crucial to avoid confronting each other. If possible, let the person find the lost item themselves when it's located. If a family member or someone nearby finds it first, they might accuse the other person of stealing it. Instead of revealing the found item, let the person discover it on their own. Perhaps something similar happened to your mother. From a broader view, caring for one another is truly significant. The third early onset symptom is spending more time on previously simple tasks like cooking or shopping. Signs may include preparing fewer varied or simpler dishes when cooking. This has been happening more frequently lately. Eating, or something like I've been buying food a lot recently. The fact that you no longer cook could mean that you're unable to cook complex dishes. And then the fourth symptom of cognitive symptoms. This explains why your wallet gets thin, which may surprise those wondering about the cause. When I say that your wallet is full of small change, it means that accounting becomes difficult. When you buy things at a convenience store or supermarket and you have to pay 635 yen in coins, how do you pay it? What is 635 yen? It becomes like that. When this happens, people with dementia, because they still have memories of the past, they don't understand how to pay 635 yen now, but they remember that if they pay with a 1000 yen note or paper money, the accounting will be done. So they try to settle the account with bills as much as possible, and they come back with a lot of coins. So as a result, their wallet becomes full of coins. This is also said to be one of the early symptoms of dementia. And so there are times when you lose motivation and abandon your hobbies or activities. People with dementia often feel insecure at their base. That's strange. Why did I become like this? That's strange. Am I not demented? But if they realize they have dementia, they don't want to cause confusion to those around them, so they keep it to themselves. I want to stay as a proper mother. There are many people who have such thoughts, so if they are likely to cause confusion to those around them, they may stop their activities or their participation in society, and hobbies may decrease. And the most important thing to note is pseudo-dementia. It's written as dementia, but pseudo-dementia means it looked like dementia, but it was actually depression. So the loss of motivation and decrease in social participation could be symptoms of dementia, but they could also be early symptoms of depression. Both possibilities actually exist, so keep that in mind. The symptoms are indeed early symptoms of dementia, but it's important to be aware that it could be dementia. Please remember that there could be other diseases as well. And now on to the sixth point. Irritability and excessive suspicion are common traits in people with cognitive disorders. This is understandable and not unreasonable. I must be cautious due to my anxiety about not knowing what happened to me. It's a situation where my family and social environment struggle to adapt well to this. Or social participation may decrease. Family conversations may decrease, leading to gradual stress buildup, and things may not go as planned. Emotions may not be sorted out properly. When that happens, it's not unreasonable to think that conflicts will naturally increase. So, when I say that conflicts have increased, it actually means that there might be some anxiety in my own memory. It might not be noticeable until you do so please remember it. That's what I said at the beginning. The early symptoms of cognitive disorders, in addition to these symptoms, actually include difficulties with spatial cognition. Things like getting lost on the road. It's spatial, isn't it? The world where I am, I went to the right, so I should turn left to return. Such things become difficult. Do you all know the difference between cognitive disorders and forgetfulness? Ordinary forgetfulness is understood by everyone. I often forget things and lose various things. For example, the kind of forgetfulness I'm talking about is this kind of forgetfulness. The kind of forgetfulness that anyone normally has is often like this. It's like, what did I have for dinner last night? The most common symptom of forgetfulness in people with cognitive disorders is something like, did I eat breakfast today? The difference is that forgetfulness means you can't recall, which is one of the three processes of memory. Normal forgetfulness means you can remember things properly. However, you can't retrieve the memories you've stored, like, oh no, I had miso soup yesterday, didn't I? If told, you put mushrooms in the soup you bought at the supermarket, you could respond, oh that's right, I bought mushrooms at the supermarket. You can recall saying, I drank miso soup, and so on. For people with cognitive disorders, the initial memory reference point hinders remembering. Even if told you drank miso soup, they don't recall it and may respond, I didn't drink it. The complete loss of memory, even when reminded, is a sign of cognitive disorders, not just forgetfulness. Patients may deny events happened, like claiming they didn't eat breakfast. Avoid correcting them excessively in such situations, as cognitive disorders may be the cause. Since there is no memory to begin with, telling someone who doesn't remember eating that they did eat is like pouring water on a duck's back. It's important to accept the feelings and facts that the other person is thinking, such as saying, "That's how it was, wasn't it?" Even if it turns into an argument, I think it can't be helped. When that happens, it's good to naturally change the topic of conversation or focus on something like, "Are you hungry now?" and suggest, "Shall we eat something?" It's very important to interact from the other person's perspective. I've made a chart comparing cognitive disorders and normal forgetfulness. I think it's easier to understand this way, so please take a screenshot or make a note of it. In terms of memory, cognitive disorders mean that everything is completely lost. This is because it's a disorder at the stage of remembering memory. Normal forgetfulness is when a part of the memory is easy to miss, like not recalling one dish from yesterday's meal. With cognitive disorders, the memory itself is missing, so recall is impossible. However, they can remember events from decades ago, as those memories were formed before the disorder. So, they can remember things from the past, but they can't remember new things because they don't remember them in the first place. But the general range of forgetfulness can remember, but just can't recall. So if told, they can recall. Now, whether they are aware of it or not, this is actually the first question I get when I say, "I'm worried about my forgetfulness, am I okay?" But those with cognitive disorders, because their memory is completely gone, there are relatively more people who are not aware of it. That's strange, they say, but they don't remember drinking miso soup in the first place, so for the person themselves, they didn't eat breakfast. So isn't it strange for those around them? Or I'm strange, it takes a while to realize. But the general forgetfulness is, I can't remember that, and they can realize that they forgot, so they can recall what they forgot. That's what it means to be aware. I forgot, didn't I? And they get upset, so that's why I'm worried about my forgetfulness. But as for that question, I think, isn't it not general forgetfulness? And I'm considering it. And then, whether it progresses or not. Those with cognitive disorders progress a little bit each year. Roughly every 2 years you can objectively see, isn't this cognitive disorder progressing a bit? That's what we call cognitive disorder. But the general range of forgetfulness is, oh, I've been worried about my forgetfulness lately. Many things have changed over the past 5 years, creating significant differences. This supplements what we've discussed so far. When we talk about cognitive disorders, the most common type of cognitive disorder is Alzheimer's type cognitive disorder. That's what we've been talking about. Lewy body type cognitive disorders, vascular cognitive disorders, and Pick's disease are other types of cognitive disorders. Or frontal lobe type cognitive disorders. There are various types, but this time we are talking about Alzheimer's type cognitive disorders, which are the most common. Please keep that in mind. Did you get that? You might be wondering what kind of disease cognitive disorder is. Let's review what we've learned so far. As early symptoms of dementia, repeating the same thing over and over again or asking the same thing. An increase in forgetting where things are placed and often looking for things. Taking more time to do things like cooking or shopping that used to be able to do. The wallet is getting bloated with small change. The motivation drops and hobbies or extracurricular activities decrease. Becoming suspicious or easily angered. I have introduced these, and so. The difference between normal forgetfulness and cognitive disorder is that normal forgetfulness is just a part of memory missing, and you can recall it when reminded. In the case of dementia, specific memories are completely lost, so even if reminded, they cannot be recalled. Like that, I have introduced the difference. The things introduced in this video have the potential to reduce the risk of cognitive disorders, but improving these does not necessarily reduce the risk of cognitive disorders. There is still much to learn about solid lifestyle habits and dietary habits. Research is still in progress. However, it is known that things like exercise, a Mediterranean diet and the like can reduce the risk of developing diseases related to life such as hypertension, diabetes, arteriosclerosis, and ultimately myocardial infarction in addition to dementia. Definitely. Even in your 80s, your brain doesn't have to age. To reduce the risk of cognitive disorders, try just one thing that can help. At YouTube Medical University, we share practical health knowledge backed by data from active doctors, presented in an easy to understand way. Because it's my motivation. To make sure you don't miss tomorrow's video, I would be happy if you could press the channel registration button. I think that those who are watching this video have a high health consciousness or have a family member with cognitive disorders. On YouTube, both medical professionals and non-medical professionals are disseminating various information. There are not a few things that can cause misunderstandings. In an era where information is overflowing, it is very important to have a credible source of information. At YouTube Medical University, the videos may be a bit long or difficult, but why do these symptoms occur and how can we prevent them? I will introduce the knowledge that can be a weapon so that everyone can think about their health on their own. So, if you like, let's study together at YouTube Medical University. And in the comment section, I became healthy when I had such a dietary habit. I struggled with similar experiences. Please share if you have related thoughts about this video. Whether the button is good or bad, it's okay. Rating it would serve as a reference for the next video. Let's meet again in the next one.